think unfortunately, again, with any surgery, it does carry its own risk. This is the same in terms of body contouring surgery as well. Main thing is again, like I call some of the the symptoms more like a side effects rather than an actual complication. Like the numbness that patient described, in all the areas that were operated on are definitely present all the time. But that numbness generally will improve after sort of 6 to 12 months. Sometimes it could be a bit more permanent, but this is where we can't always predict how the sensory recovery is going to go. I guess some of the sort of genuine sort of complications that can occur, maybe wound infection, or sometimes there's some delay healing. And delay healing, by that I mean, there may be areas that, just take longer to fully sealed up and might require some daily dressing, and that's unfortunately reasonably common, in patients with body contouring surgery after massive weight loss. And I think that is sometimes just a result of the nutritional status that may not be fully optimized. And so, that's when, if I go back to looking at that to make sure that they are, eating well and that they're not deficient in any of the micronutrition, are quite important to, reduce that risk of delay healing. I think the other common thing that can occur is what we call seroma, and that just means fluid collection around some of the surgical site. Often that can be minimized by using the garments that we prescribe, and that will help to compress the area, and that will help to reduce the fluid collection. If it does happen, it might just require an ultrasound guided drainage, and often doesn't require return to theatre. I think the more sort of serious thing, obviously, if there's a major sort of wound breakdown or any what we call skin necrosis because of the poor blood supply or the circulation to the area, then that's when you require readmission to the hospital and have to have further surgery. But I think this is where I tend to be a little bit more conservative with the resection as well, because I think that is one of the key things in terms of minimizing the risk of having blood supply issues and having major wound healing problem. So I think all these sort of different approaches that I included in the operation hopefully could help to minimize having major wound issues, which is probably the most serious consequences in body contouring surgery.